Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I have a special guest with me, Ramya Kumar. Welcome, Ramya.
Thank you, Kristen. Good to see you.
It's wonderful to have you here. You, of course, have a presentation for us in our lecture pack which is right now an add-on package for our Lactation online conference of 2025. We're getting started in it's just around the corner next month, basically. And your presentation is titled Developing Feeding Skills and Fostering Sensory Development in the Late Preterm Infant. And I'm very excited about this presentation. But first of all, before we go into that topic, tell us a little bit about yourself. You are a speech language pathologist, is that correct?
Yes, I'm a pediatric speech language pathologist, and over time have added more letters and training and credentials. So I'm also an IBCLC. I work with the preterm population, and so have looked at things. I'm certified in things like neonatal massage, trauma-informed care, caring for the small baby. So all of those aspects of development that help support the babies as far as feeding, but also just overall development that leads to the process of feeding.
Absolutely fascinating. Thank you for that. And you work, of course, also in the NICU with the little ones, very, very little ones you mentioned, right? And this time your topic is about the late preterm infant. And, this is actually really fascinating because these babies, they can look quite term, right? In some cases, and we expect a lot of feeding difficulties with the little ones, the very preterm infants. We can understand that, but often it can come as a surprise when we see a baby that's almost full term, and we think and then that baby shows difficulties feeding and shows other difficulties as well. Can you talk to me a little bit about that?
Yeah, absolutely. It's exactly what you said. These babies look bigger and they act bigger. And sometimes parents are told that,
Yeah.
they're said, oh, your baby's now 34, 35 weeks. You're out of the woods. You're not going to go to the NICU. You're fine, all of those things. However, yeah, these babies, we call them the great pretenders. You'll hear me talk about that in my presentation as well, or the great masqueraders. And they literally are pretending, or what I call honeymooning, and like kind of coasting through until they're not. So there's just a lot of unpredictability with these babies because, again, we often will treat them or assume that they are going to be very similar to the older babies, but they have a lot of things that they're working on as well, as far as their lungs and how their senses are developing and how even their brain is developing, the size of their brain. And I think a lot of it comes down to just how we're setting the parents up for success. Because when these babies don't come to a NICU, for example, they're going home pretty quickly, just like a full-term baby
Exactly.
would, right?
Yeah.
So
Yeah.
within anywhere from 2 to 5 days, depending on a vaginal delivery versus a C-section. And a lot of times when they get home, and I also have an outpatient practice where I follow babies and families outpatient, a lot of times we'll catch these babies there, or they're getting readmitted to the hospital for different feeding needs. And so I think it's just a population that we're starting to look at more closely, and the
Hmm.
research is evolving as well on just outcomes for these babies as well, because we do really well with the itty bitties and the young ones,
Right.
and we
Yeah.
do fine with the older ones because they kind of are fine, they go through it, but then this category can fall through the cracks, so we're trying to catch them.
And you're so right. I've seen this over and over again that parents are even taught, by healthcare providers. Oh, the baby's out of the woods, everything is great, and they go home pretty early. And I feel like as healthcare providers, I feel like without scaring the parents, but would it be helpful to kind of educate them earlier for things they might see or to be aware of?
Yeah, I mean, I feel like personally, like education early is always important, right?
Hmm.
Especially because if you think about, whether it's in prenatal classes that are
Right.
happening or any of that, right? The OB offices, because in the moment of delivery and immediately post-delivery, there's so much just hormonally that's happening, right? With
Yeah.
the birthing parent and the family, and then the stress, and like it's like there's all kinds of emotions, happy and like, stressful ones. And if we just think about our brain, like we're not going to retain information that's provided to us in that moment in time,
Mhm.
right? And everything's going to seem high stress, and even the smallest thing is going to be magnified, and we may not process that. And we're also like, I
Right.
just want to go home. I was promised I'm going to
Yeah,
go
of
home.
course.
And we're letting the family down almost in their emotions. So I truly believe that anything that we can provide as far as education and just preemptive education, when the parents are in a sensory space in their
Mhm.
brain and a trauma space where they can actually absorb stuff and be prepared for things, is
Right.
always beneficial, and it's less threatening or doesn't feel as a threat or an issue or stress in that moment if they already knew it could happen.
It could happen, correct. So, Ramya, when you are called in for one of those little imposters, those little late preterm ones, what are the first things you look at that you wouldn't necessarily look at? I mean, obviously every case is different that you're called to, but what stands out to you that you might be looking at first, or what you feel like this is something that those little ones show more of?
Yeah, that's a good question. So when I come in just from my lens as a neonatal therapist, that's, really grounded in overall development of the baby, because usually the consults when I'm getting them, they're because the baby's not eating,
In the
or
end,
they
not
need
eating,
to
yeah,
eat,
correct.
right? And while it's easy to very quickly go to like the mouth and the latch and the anatomy and, all of,
Mhm.
and like mom's supply and all of those things, which are all important as well. For me, my first when I walk into that room, I'm scanning the room right away. I'm like,
Mhm.
what does this environment look like? How
Right.
many people are in this room? How loud is this environment? How bright is it? Is this baby sleeping? Are they not sleeping? How are, if they're in the crib, are they swaddled? Are they unswaddled? How is their positioning? Just all of those aspects of motor development and sensory development, because they
Mhm.
are developing 4 to 6 weeks earlier outside of the womb than their term counterparts. So all of a sudden, they were just in a dark, quiet space with no gravity, fluid filled, muffled sounds, and now they're in bright lights, camera, action. And so that is a huge component for me that I look at.
Yeah.
And I'll talk to parents about the developing brain. I have images on my phone that I'll pull out to show them, like, images speak volumes for any of us, especially if we're not
Right.
in healthcare. And then I'll start to slowly chip away at some of those things before I even take the baby to the breast or the bottom,
Mm.
depending on what the feeding choice is.
That's absolutely great. I love how you describe that because, as you're absolutely correct, when somebody calls you or an IBCLC, it's because the baby is not eating, right? And the first thing is, of course, we want to jump into action and get the baby to the breast and get the baby feeding because the baby needs to eat. But also what you mentioned there is really stands out to me, like really scanning the environment, scanning the room. What is it like? Who's in the room, and such, because looking at the big picture can make like such a difference there as well. And
I also like to, oops, sorry.
yeah,
I
go
was
ahead.
just gonna say, I also like to, I always will ask too, like, when was the last feeding, right? Because
Yeah,
sometimes, like, these parents aren't given realistic expectations. Or I
true.
had a baby recently where when I asked what the first feeding was, like the volume, because this baby was a bottle feeder, it was like some crazy large volume that I'm like, that's not even the size of the stomach. So of course she's not going to wake up to eat. So I
Right.
think again, you just have to look at not just that moment in time, but what has been happening prior to this that might be
Yes.
leading to this fatigue, everything from temperature to their sugars, all of those aspects. It's the whole picture, not just that moment of the feeding.
Hmm. And since they are so much or a little bit out of the womb sooner than their full-term counterparts, their sensory development is also like it's all still baby might look like it can
Mhm.
do a lot, but there might still be a lot of other things going on, and maybe the input is too much for the baby, right? Do you recommend swaddling in that case? And if so, because swaddling gets a bad rap for various reasons, of course, what is your opinion on that?
Yeah, no, I'm glad you asked that question because absolutely swaddling is a hot topic.
Hmm.
We do recommend for the late preterm infants, and sometimes I've had to use this even with term babies, depending again their tone, their arousal, all of that. Um, the swaddling is recommended, and the reason for that is if we think about the swaddle, I always say think about it as the womb, right? They
Hmm.
just had these boundaries that when they pushed, something pushed them back. or they
Right.
knew where they are in space. They weren't just floating. And when they come out of the womb, they are essentially floating because now there's gravity and there's nothing to put them back into flexion. Their muscles are still developing. Their what's called their sense of their vestibular sense, which is the sense of balance. Where am I at in space? What are my joints doing? Is still developing. And so when we add a swaddle, we're giving the brain information of where are these joints and muscles in space. And what that does is it takes the load away. It's really about decreasing load. So if my brain doesn't now have to focus on where am I at? Why am I moving? Is this where I'm at? Am I safe? Am I going to fall? Am I in space? If I can take that away from my brain can now reshift focus into the reflexes to suck, swallow, and breathe. It can now focus on staying awake. It can now focus on regulating my temperature. So if we think about swaddle as a tool to support what else can the baby do if we minimize this aspect, I think it shifts our focus and it shifts our reputation and what we think about swaddles. Now, prolonged swaddling, extended swaddling, all those things have its downsides. But in the early days of our late preterm, we have to support big muscles, our gross motor stability, in order to have fine motor stability. And eating is a fine motor task. If we don't support big muscles, our small muscles are going to be weak and tired very quickly.
I love that explanation. That's so helpful to explain it also to parents and, the logic behind it, why it's done. And, and I assume you will, show, of course, that in your presentation, you'll have some videos and pictures of that as well. Correct, right?
Yes, yes, there is a video of a baby that's bottle feeding, not breastfeeding, but bottle feeding pre and post swaddling, and it's a late pretermer, and you'll just see the dramatic difference there.
Thanks. Well, this is all very exciting. I can't wait for your presentation here, Ramya, developing feeding skills and fostering sensory development in the late preterm infant. Before I let you go, any final wise words when it comes to the topic here for our viewers?
I just will say again, these are the great pretenders. They do need extra vigilance. They will show off until they cannot. So just don't let the first day or two or even week trick you. Just please make sure that either if you're the parent or you're the supporting the parent, that they have some ongoing support, at least for the first few weeks of life.
Well, Ramya Kumar, thank you so very much for being here with me today, talking about your work and the background of, and of course, the wonderful presentation that you have planned here for us at Gold. Thank you.
Thank you, Kristen.
And now some information for our viewers. If you'd like to find out more about this particular presentation and the other presentations in the lecture pack, and of course with the Lactation online conference that's coming up next month, we would like to invite you to go to goldlactation.com. There you can also sign up for your free keynote presentation that we have available for you. So we hope you're joining us for that, and I hope to see everyone at the conference. Bye-bye, everyone.